What is response to intervention, or RTI, and how will it look at Udhailiyah School? Basically, response to intervention is a framework for providing systematic supports for all students. There are four essential components of RTI. 1. Multi-level prevention system. 2. Universal screening. 3. Progress monitoring. And 4. Database decision making. So what will that look like at Udhailiyah School? Let's break it down. All right, so breaking it down to the essential component, multi-level prevention support. So when we think about RTI, a lot of times we think about the triangle, and that is 80% of students at that tier 1, and then you have 10 to 15% at tier 2, and 5 to 10% at tier 3. One way to think about this multi-level prevention system is through a medical analogy. When you go to the doctor and you complain of certain symptoms, or you even have high blood pressure, the doctor doesn't automatically say, oh, we need to have surgery. Instead, the doctor might start with a low-level intervention, or an intervention such as diet and exercise, something that everyone has access to, kind of that tier 1 level intervention to begin with. Now, if you're not responding to that, and after recording your blood pressure for several weeks, the doctor might then suggest something such as medication or a tier 2 type of intervention. And then if that's not working, he might then recommend something higher level, like an additional medication or a tier 3 intervention, in order to reduce your blood pressure. So in schools, the tiers of intervention refer to different levels of support students might be getting. Tier 1 are universal interventions that are available to all students. This might be simply a small differentiated group within the classroom. It might be preferential seating. It could be extra time on a test. Tier 2 is a more targeted intervention. Let's say after the screening and some diagnostic assessment, we identify the concern as fluency for a student. We might put them in a Read Naturally group. A Tier 3 student would be a student that is not responding to the Tier 1 and Tier 2 interventions and might need even more intensive support, or increased level of support or time. One of the most common pitfalls to implementation of RTI is making sure that the intervention happens on a regular basis and with integrity. We need to ensure that there's set aside time for intervention to occur. One of the things that you'll notice that's different this year is locked in intervention time that is built into your schedule. You should be receiving those times in the next few days so that you have an idea of when intervention will be occurring in your classroom. This allows for specialists like the speech and language pathologist, the learning support teacher, the counselor, educational psychologist to be available to help support you within the classroom. All right, let's break down the second essential component to RTI, screening. Okay, let's think about that medical analogy again. When you go to the doctor, they're always screening your health, like taking your weight, checking your blood pressure, maybe taking your temperature, to get an overall idea of where your general health is. Similarly, in schools, we utilize screening to get a general idea of students' overall academic abilities. When selecting a screening tool for implementation of RTI, it's really important that you think about the psychometric properties of the screening tool along with the efficiency of administration. And the National Center on Intensive Intervention, along with the National Center on Response to Intervention, do a nice job reviewing tools that are used for screening. So for purposes of RTI this year, we will be using Dynamic Indicators of Basic Early Literacy Skills, or DIBELS. DIBELS is a psychometrically sound instrument, and it's pretty quick and easy to use. It also has an iPad app that goes along with it in order to make administration even easier. We will also be using the STAR Math assessment and continue using the NWEA MAP assessments. And we'll likely be piloting some new NWEA MAP assessments, including their new reading fluency measure. Breaking down the next essential component of RTI, progress monitoring. Okay, let's go back to that medical analogy. Progress monitoring would be like asking you to regularly check your blood pressure after putting an intervention such as medication in place. So in school, we might put an intervention like Read Naturally or the Lindamood LIPS program in place for a student, but what we need to do is make sure that the intervention is working. So we use progress monitoring tools like DIBELS or STAR Math or a writing curriculum-based measurement in order to see if something's working. After assessing a student's progress over several weeks, we might look at what's called their rate of improvement or their growth rate over time. And we're looking at the rate of improvement to be above what we'd expect of a student that was at benchmark. Okay, let's break down the fourth essential component to RTI, database decision making. In Udhailiyah, we will be conducting DAT team meetings or data analysis teaming meetings once a month. We'll be using our data in Alpine Achievement along with all the progress monitoring and screening data in order to engage in conversations on student achievement and student progress on a regular basis. These meetings will include the principal, the school psychologist, the learning support teacher, the speech pathologist, and the general education teachers. And we work together in order to analyze the data and make determinations on what intervention students need. Right, let's recap the four components of RTI and how that changes things a little bit at Udhailiyah School. First, multi-level prevention system. We will make intervention a priority and make it part of our regular schedule. 2, screening. We will be using dynamic indicators of basic early literacy skills, STAR Math, and MAP assessments for screening. 3, progress monitoring. We'll now have access to tools that we can utilize to regularly monitor the progress of students that receive intervention. 4, database decision making. We'll have monthly meetings to discuss student data on a regular basis.